Is it annoying yet? If your child was doing this, would it annoy you? Maybe not annoy you, but it may cause you to question, Johnny, why are you doing that? Stop moving your head. What if your child said, I can't? Or, what? I didn't even realize I was doing that. Would that concern you? This is a case that I had recently, and so let's talk about what it may be. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Repetitive motor movements may be a tic. A tic could be a head movement, a tic could be a lip movement, or an eye movement, or all kinds of potential movements. But a repetitive motor movement where the child has an urge to do it and can suppress that urge, but the longer that they suppress the urge, the more they want to do it until they eventually do it, is a sign that it may be a tic. Things that you want to ask yourself are, has the patient been infected recently? Has the patient had head trauma recently? Has the patient shown any change in behavior or mood that is not like that child? Have they lost interest in eating or in foods that they like? Have they regressed in school and in learning? Have they regressed even in potty training? These are things to look out for when trying to differentiate, is this a tic and something neurologically or metabolically that needs to be investigated further, versus is it something structural where maybe they need some chiropractic or massage or some kind of manual therapy to work on ligaments, joints, or muscles. And if you do that and it's addressed and it's gone, you know what it was. But if you do that and it doesn't even touch it and they continue to have it, you may need to investigate further. Now, if they've been infected recently, then there may be an infectious cross-reactivity with brain centers leading to the tic. They could have been infected without it being obvious. For example, you could have strep infection without having sore throat, etc., the typical strep symptoms that we think of. Strep is not the only infection that could drive or cause a tic. There are many, many that could do this. So what I wanted to just get across today is that if there's a weird or new or different motor movement that's repetitive and there's an urge for it and the kid maybe doesn't know they're doing it until you bring it up to them, if it's not reduced or eliminated with manual therapies, you may want to think about head trauma and or infection or metabolic causes.